This is a scrotal ultrasound of a 17-year-old with a complaint of pain in the testes. Now in transfer section, we are seeing this scrotal wall thing, and here, this is the left testis, this area in transfer section, and we do see cystic, tiny cystic areas which are suggestive of possible varicoceles on the left side, whereas on the right side we do not see the testicular tissue. You can see that the testes should have appeared as this we are seeing in the left one. We only see a hypoechoic area measuring 2.27 into 1.82 centimeters. This is the hypoechoic area with mild posterior wall acoustic enhancement. So the testis on the right side is not visualized. Rather, in place of the right testis, we see a demarcated hypoechoic area which gives posterior wall acoustic enhancement. Now let's first study the normal one. This is the left testis in longitudinal section, and you can very well see that mediastinum testis is clearly seen. Thus, you can easily declare it to be a normal testis. This is the central line that you are seeing in this thin line is the mediastinum testis. Testis measures 3.8 centimeter in length and 2.0 centimeter in anterior-posterior diameter, with no focal lane and no calcification. The scrotal wall is thin. Its echogenicity is mild force, echogenic, but evenly placed. Echoes are evenly placed. There is no heterogeneity, and the normal testicular echogenicity and texture is as we are seeing in this image. Now this is the normal testicular image. Now this is the longitudinal section of the left kidney, and this is the transverse section of the sorry, I may have said kidney, it is the testis, sorry, so please correct it. That was the initially you were seeing the longitudinal section of the left testis. This is the transverse section of the left testis with no calcification, no focal lane, and intact membrane, measures 2.69 centimeters in depth. So the left testis is normal by itself, in itself, and
operation methods.
We don't see any fluid in the left hemiscrotum. However, this image that you are seeing, this area is the epididymis, left epididymis. This measuring 13.6 millimeter into 5.4 millimeters. So this is the transverse section of the a bit. This is the testicular tissue, and this is the epididymis. So the epididymis is normal. The longitudinal section is not transverse. Sorry, once again. This is the longitudinal section of the left testis, and in the center, this linear structure, hypoechoic linear structure, is the mediastinum testis. So the left testis is normal, the hemiscrotum is normal, there is no fluid in this region, and the epididymis is seen normal. यार फोन देखना मेरा टाइम रजीम का आएगा मैं उन्हें करना रिंग बैक. Now this is the right hemiscrotum. I am focusing on the right hemiscrotum. Testicular tissue is not seen. If you keep the, if you see the, here I am going to place the normal for the comparison purpose. Now this is the normal testicular tissue, this one, and we do not see any such area in the right hemiscrotum. This is the right hemiscrotum. Rather we see only a hypoechoic area measuring approximately 16 by 19 millimeters in this section. So this is the longitudinal section of the left testis, and this is the longitudinal section of the right testis. This is the left testis, and this is the right hemiscrotum with no testicular tissue seen in it, and only a hypoechoic area is seen measuring 19 into 16 millimeters with no calcification in this hypoechoic area, and faint posterior wall acoustic enhancement in those two definitely present, well demarcated. So this is now it's difficult to tell this. It is the testes or mass or an abscess. Up to this point, we cannot say, we cannot comment on this very possibility regarding the hypoechoic area that is seen in the right hemiscrotum with no testicular tissue seen in this region. This is the left testis. This is the left hemiscrotum. This is the scrotal wall. Now this is the right hemiscrotum. There is no testicular tissue of this sort seen in this right hemiscrotum. In its place, we see a well demarcated hypoechoic area. This area. This is right hemiscrotum, and this is the left hemiscrotum, and this is the testis. This is the, now this thin line is the mediastinum testis. So now in the right hemiscrotum we do not see any testicular tissue, or rather only a hypoechoic well demarcated mass is seen. with no calcification in it. So we have to make sure that if there is any the right testis is located or in any or displays or is seen in ectopic location. So starting from the pubic region and coming downwards towards the scrotum, at least there is no evidence of any testicular tissue in this region. This is the groin. Is it in the suprapubic location? No. No evidence on both sides. So the testis is not seen in any other location. This is the urinary bladder in transverse section. This is the urinary bladder in longitudinal section. They are normal. This is the seminal vesicle. It's normal. This is the prostate, normal for the age. 17 years. Okay. Now let's see the kidneys. बेटा गंदा सांस रोक लो. Now this is नहीं सांस बाहर निकालना. This is the right testis with patient in supine posture. Sorry, this is the right kidney with patient in supine posture. Okay, nasal pepper. And this is the left kidney. Both kidneys are normal. This is the left kidney. Both poles are clear. No focal lesion, no calcification, no hydronecrosis, intact corticomedullary differentiation. Now I am going to give a sweep from the subcostal region down up to the right lower abdominal quadrant to see if there is any suspicion of testicular tissue in any ectopic location. I don't see it, at least in this location. Bowel gases in the epigastric region coming down. These are the bowels. Now these are the right iliac vessels. You will be seeing the movements. I have magnified the view. You can see these are the left iliac vessels. There is no lymph node or hand or any solid area in its location seen. These are the right iliac vessels. And down we come to the urinary bladder. Better full time. And here we are again with the pathology. Now this is, I'm going to magnify the view, and in magnified view we see that there is no testis seen. and there is no herniation of the bowels in the subrotum, right side especially to be kept in. Most importantly. So now this short tail-like structure and this area with hypoechoic area with the regular wall, thin wall is the pathology, and these are the सांस लेके सांस रोकने ऐसे लो. These vessels that I showed you initially also are the varicocele. This one is 4.4 millimeters. So this is the case of the day in which I am going to report only the findings, cannot give you the exact nature of the pathology, though my own impression will be that this is a small size atrophic right testis with loss of its echogenicity or having decreased parenchymal echogenicity. You see, now you can see the thin line in the center of this right third-like structure. In the center of this area, it appears to be of a test oblong as we see the testis. So most probably this is the testis. It is small size, and its echogenicity has gone down significantly. This measures 3.2 into 1.5 centimeters. So in this case, I will at least be of the opinion that this is a case of atrophic, small-sized right testis with no epididymis seen, and with a markedly decreased echogenicity, and the texture is not that as we saw in that. As when we compare it with the left kidney, it is much softened out. So this is our case of the day. Thank you.